Good morning. Happy Monday. Hope you are feeling healthy and well. Thank you for joining me. And today we are going to talk about specific recommendations for male patients during their wellness visits. If you did not see my initial video that was released 2 weeks ago, please check that out because it will go over general recommendations for all patients during wellness visits. We went through checking blood pressure, vaccines, colon cancer screening, lung cancer screening, general lifestyle screenings. The video that we had last week went over specific recommendations and guidelines for female patients, and today we are going to give time for the male patients. These patients tend to be the ones who avoid going to the doctor more than anybody else. Many times my male patients come in and they say they are here because their girlfriend or wife or mom made them come or made their appointment or maybe even drove them to the visit, or else they would not have come in. But that's not always the case. Sometimes I have male patients who are very on top of their health, and I applaud them for that. We all should take ownership of our health. And one way to do that is to schedule an appointment with your primary care doctor or establish with a primary care doctor if you don't have one. In my very first video, I went over the top 3 reasons of why you should have a primary care doctor. So check that one out if you have missed it. While I'm thinking about it, I'm going to ask you to like and subscribe to my series because I am going to continue to release videos every Monday morning, and we're going to talk about health and wellness, prevention, lifestyle, weight management, metabolic health, and anything that you have questions about. Please let me know and I would be happy to make a video for you. All right, so enough talking. Now let's talk about those recommendations for male patients during wellness visits. All right, and for my male patients, I have a similar approach. We go through a checklist together to make sure that they are up to date and covered from a prevention standpoint. And so we go over the colon cancer screening that was discussed in my last video. Next, we talk about the lung cancer screening, which was also previously discussed. So check out that video previously. Next is prostate cancer screening. So prostate cancer screening is not as clean cut as the other cancer screenings. And there are complicated reasons why that is. And I try to go over them with each patient because it is important that patients know why. It's important that you know why these guidelines have changed over time and why you may be told something different than you were told before. So initially, what was recommended was that essentially all men from their 40s to their 70s and sometimes beyond were to be screened annually for prostate cancer. And that has been done with the digital rectal exam and a blood test called prostate specific antigen or PSA. With this routine and regular screening, what we found is that prostate cancer is actually very, very common. It's the number 1 diagnosed or most commonly diagnosed cancer in men. However, it's not typically aggressive. And so what that means is that most men who have prostate cancer die with their prostate cancer. They do not typically die from their prostate cancer. Or should I say, most men who have, another way to put that is that most men have prostate cancer and they probably would never know that they have prostate cancer because it does not impact their health or their longevity or how long they live. Now, that is true in most cases, but there are some more aggressive forms of prostate cancer that we do want to pick up, but that we do want to know about. And so we need to find the balance. When we were screening annually, when picking up prostate cancers, we were then having these patients undergo additional diagnostic testing that was more invasive and had complication risk to it. Or men were getting treatment, whether that was surgery immuno or chemotherapy or radiation, and they were having complications that they may not have needed to undergo because their prostate cancer may have been or likely was the slower growing type. And so their diagnostic evaluations and their treatments were causing more harm than benefit. So that has been so significant that some medical societies have actually said that the harms outweigh the benefits of prostate cancer screening. The USPSTF, United States Preventative Task Force, has recommended against prostate cancer screening. Some providers do not screen for prostate cancer. They don't recommend it, especially for asymptomatic or for men who are not having symptoms and with no family history. Now, over many, many years of gathering data and advancing technologies, is that we can use more information about patients from the family history, the PSA, prostate-specific antigen levels. We can do non-invasive tests like MRIs to evaluate what the prostate looks like on imaging prior to requiring a biopsy or recommending treatments. And so because we now have these less invasive, less risky ways of gathering information about that specific prostate cancer for that specific patient, it is now safer to manage and less likely to cause undue harm to men. And because of this, we are now starting to, or most societies are now starting to recommend prostate cancer screening again, but in a less frequent duration, lower frequencies. So for my practice, I typically start the discussion of prostate cancer screening around age 40 to 45. And what I consider doing with these patients who want to have screening, and I do give them that option. I do not require prostate cancer screening for my patients if they do not want it. What we will do is we get that PSA, we get that blood test, that prostate-specific antigen. We get a baseline level, again, around age 45. And then in a couple of years, we will repeat that PSA, that blood test. And if it's remaining low and stable, that's really reassuring. And we can continue to do that over the next several years up until around age 70. Then I usually consider stopping screening because, again, it's a slow growing cancer in most cases. And so if it has not developed at age 70, then we don't need to worry about it. If any of the blood tests come back positive along the way, or they come back elevated along the way, or we see a bump in the number, then usually I repeat it to confirm. Then I refer them to a urologist, a prostate cancer specialist, who will then gather that additional information for the patient to determine what the next and best course of action would be. So you can see it's a complicated decision and not as straightforward as some of the other cancer screenings, and it's probably going to change in the future. So talk to your doctor about what makes sense for you. Another recommendation that is unique to my male patients is abdominal aortic aneurysm screening, AAA screening for short. And what that is the test is actually an ultrasound of the abdomen. So it's a very easy and quick test to do, no radiation. And what it's looking for is like a dilation or like a ballooning of the aorta in the abdomen, the abdominal aorta. The aorta is the really big blood vessel that comes from the heart that helps supply blood to the rest of the body. The reason that men are screened for this is that they are much more likely to have an abdominal aortic aneurysm, but not so much that every man is required to or is recommended to be screened for this. Any man who is 65 to 75 and has ever smoked in their life qualifies for this one-time screening. Again, it's a quick ultrasound, very easy to do. You just have to do it once. If your aorta is normal appearing, then you are covered. You do not need to repeat it. If there is an enlargement or a dilation, then depending on the size, you'll have recommendations after that. Otherwise, the remaining of the appointment is similar to all adults. We go over vaccine recommendations, we go over lifestyle, diet, exercise, tobacco, alcohol, and drug use. We go over potential risk for sexually transmitted infections. We talk about getting blood work at that appointment. Again, I'll have a video that specifically goes over the typical labs and what they mean. We go over heart disease risk. I will have a video in the near future that talks about heart disease, what we can do to prevent it and manage it. We also screen for depression. I did not mention that before, but for all my patients, really most visits in primary care now, we screen for depression. And it's something that we address if the screening is positive. We check their vitals, again, specifically blood pressure, weight, and watching that over time. I will definitely have more videos about weight management and how to address that. Very exciting, something that I am very interested in helping patients with. That wraps up the male preventative health visit, the wellness visits that I recommend annually with your primary care doctor. If you have any questions, if there is something that you would like me to address, general health question, something that maybe you did not want to bring up with your doctor, please comment below. Let me know what you would like help with, and I would be happy to make a video about that. If you enjoyed this, please like and subscribe and stay tuned for the next video on Monday mornings. Take care.